This episode of Tolle Run is brought to you by FitSock, the Carrie Training Camp, and MTech Results. Hi, I'm Olympian Carrie Tellefson, and today I'm answering questions submitted by my viewers about running and pregnancy. So let's get after it. Well, I'm here with one of my best friends and doctors, Dr. Angie Voight. She delivered Ruby, so she was the first person to ever meet Ruby, and you've been kind of like an aunt to her ever since. So I invited her today to help me answer some of my viewers' questions. So let's get to it, Ange.
All right.
So Erin wants us to chat about running and conceiving myths and truths.
Probably the more common myth about training and pregnancy is that if you're running or if you're doing some endurance sport, you might not be able to get pregnant. And I think that it's been shown that if you stay at a moderate or easy level of training, it doesn't affect fertility. And I think if you're having regular menstrual cycles and you're ovulating, that's the most important thing for being able to get pregnant.
Oralee was wondering if it's safe to run a marathon while pregnant, particularly in the first few weeks, and if you can still run it at goal race pace.
I think if you're training for the marathon and you're able to get pregnant, it shows that your body was doing okay, that you're able to get pregnant, and then it should be safe to keep doing your event and to run the marathon, and I think even probably a lot of people are pregnant when they run a marathon, and it's early on and they don't know, and there hasn't been any research done to show that there's any adverse effects to doing that. There's always a risk of dehydration, and you need to make sure that you take care of yourself during the race. I think that's true in any case, though.
Beth wants to know how far she can run while pregnant. She's also wondering if I use a belly band.
I think that depends on how much you've been doing and what you've trained to do. I think staying at the same level that you've trained at during your pregnancy is safe. So if you're doing long distance runs, it's generally okay as long as you pay attention to hydration and not overheating and things like that. So I don't know that they've ever looked at pregnant women doing ultra races or anything like that, but so I don't know if that's known, but I think as long as it's within what you have trained to do, it doesn't make any difference.
Okay. She was also wondering about the belly bands. Have you had a lot of questions on that?
I don't. You are the expert on that. I don't know.
I don't know if I'm an expert. I wear one every now and then to support my belly, but it kind of bugs me a little bit more than it probably helps me. So I wouldn't say I wear it every day, but there's some weeks where I throw one on and, see if it helps a little bit. But at the same time, I like to keep my core nice and strong, so I think that holds it up as well. So
exactly.
I guess everyone's different.
Yeah.
Jillian asks if I monitor my heart rate closely, specifically if I go above 140 beats per minute while pregnant.
The only research that I've seen recently on an actual heart rate level for that's safe during pregnancy is they looked at 6 Olympic level endurance athletes, and they had them exercise up to 90% of their max heart rate. So they were going really hard.
Yeah.
And they found that only above 90% of max heart rate were there any possible adverse effects where they were monitoring the blood flow to the uterus, they were monitoring the fetal heart rate, and they found that level, the fetal heart rate dropped a little bit, the uterine blood flow dropped a little bit, and the minute they stopped running at that max heart rate, at 90% max, it went right back, and there weren't any long-term adverse effects. But the thought was that maybe if you need an absolute cutoff, what you shouldn't go above is 90% of your max heart rate. But so that's very individual, and there isn't one set number necessarily to go by.
Lauren Fleshman wants to know if there's anything you can do to run further into your pregnancy, or is it just the luck of the draw?
It's somewhat individual, and I think probably the main thing depends on how much you've done prior to the pregnancy to get yourself fit.
Yeah. Well, I always think, too, for me as an athlete, I'm not trying to become more fit as a pregnant runner. Like right now, I feel like I am a mommy and I'm a pregnant runner. So I want to tell everyone that I'm pregnant first and then I'm a runner. So pregnancy has to be number one in your priority list. And then getting runs in, getting lifts in, all of that is secondary. It's great, but we have to remember baby comes first. Shayna and Jacqueline were wondering if you can run right up to the delivery date.
It is possible. It has been done. I think 2 years ago, a woman in the Chicago Marathon ran the marathon and then delivered that afternoon or that evening. So I think it's possible to run. And I think you ran right up until before Ruby was born. So it's very possible. But I think it depends on how the pregnancy has gone and how you're feeling. I think after a while, it gets difficult just to carry a baby and run. I mean, you would know what it's like to try to grow out and
It's a heavy
run.
belly.
Yeah, yeah.
So then what about afterwards? Can we start up a day later, a week later? Is it 6 weeks later? What is your recommendation?
Well, I think a lot of times 6 weeks is a general recommendation. Again, it's variable depending on, did you have a regular delivery? Did you have a C-section? Those things make a huge difference in whether you're able to start back right away or not. How long did you wait to go back?
I waited till 4 weeks. I
Okay.
took a full month and said, this is little Ruby and this is my workout, getting up every 3 hours.
Yeah.
Thanks for joining me for my talk with Dr. Angie Voight on running while pregnant. And obviously make sure you talk to your own doctor before you get after it. It's kicking right there. Ruby was born 5 days from this date right now, 38 weeks. So I could have a baby in 5 days. Ah!